Nearly 70% of Americans are on at least one prescription drug. More than half take 2 or more. So if you're tired of spending a fortune at the pharmacy, listen up, because pharmacist Mona Vand is here to share some insider secrets. The whole idea is to save you cash. Mona, thanks for joining us.
Something we all want to do.
So we all want to save money. What's your first pharmacy secret for us?
My first tip, this is my favorite one, and it's to use a pill cutter. Now, a lot of medications, they come at different strengths, but that's not what changes the cost. It's really the amount of medication you're getting. So this is a really good tip for people who don't have insurance. So let's say you need a 10 milligram dose. Ask your doctor to write you double the strength and just cut the pill in half. Cut the pill in half, cut your cost in half. It's that simple.
I love it.
Yeah, it's pretty easy.
2 months supply. One thing to keep in mind, though, maybe not with your extended release pills, because, they're formulated a little differently.
Definitely.
So make sure your doctor doesn't give you the extended release, and then chop them in half. You got 2 months.
It really
worth.
is an easy way to save money. All right,
Yeah.
tip number 2.
Tip number 2 is to ask for your over-the-counter prescription. Just ask for your doctor to write it as an actual prescription. So I'm talking about anything over-the-counter.
So you show
Love
up with the prescription, and then you're able to use your insurance to
And
pay
if you
for it.
didn't, you can have your pharmacist call your doctor and ask for it. We'll literally walk out into the floor, grab a Tylenol, bring it back, and write a prescription for it.
Wow, where do you work?
Yeah.
Where does this
I know, you just have to
happen?
ask. I don't know if you know these tricks.
Okay. I love that.
Right?
But you have another one.
Yes, I do have another one. Okay, so older medications. Now, every medication is in a drug class, and pharmaceutical companies are always coming out with a new medication. Now, newer isn't always better. Sometimes,
Hallelujah.
right? So it's sometimes just as effective as the older ones, because when a new drug comes on the market, it has to go through FDA approval, drug testing, and that's expensive. So more money for the company is more money for the patient. So if you're getting a new medication and it seems hot and it's marketed, just ask your doctor to write something. It's been on the market longer, already has a lot of data, and is much less expensive.
So in other words, don't go to your doctor and beg and say, no, I need the one where they're harm and harm because they look really happy.
Yeah.
Because you're going to be a lot happier with more money in your wallet. Trust me.
Exactly. Newer isn't always better. It's just, it's new, so they have to market it, and they're trying to get it out there, so you think it's really exciting, but just go for what you're comfortable with and what's less expensive. It's just as effective.
So these are really
Love these
free,
tips,
applicable
guys.
tips we can
Yeah.
start using today. Mona, thanks so much for
Thank
joining
you so
us.
much for having me.